Is temple filler safe? Volume loss in the region of the temples is commonly seen with advancing age, often as early as your 40s. The cause is loss of subcutaneous fat, so it's more common in those who are lean. It may be accompanied by volume loss of the cheek area and under eye area. Injectable fillers are used to restore volume in these regions. Hyaluronic acid fillers such as Voluma can lift the temporal region, and softer fillers such as Volbella is used if the volume loss is more above the brow than over the temple. One key safety feature of these HA fillers is that they can be dissolved at any time with a naturally occurring enzyme called hyaluronidase. HA fillers have a long history of safe use in the hands of experienced clinicians. The use of such fillers in the temple and forehead areas are considered to be off-label, meaning not FDA approved for use in this specific region. With proper training and experience, they can be safely used. The key to safety in the forehead is depth of placement and not injecting into a blood vessel. In the temporal region, placement and depth of the needle, as well as proper injection technique, is key to safe treatment. Expected or possible side effects are bruising and mild tenderness over the injection site. If volume loss of the forehead is being treated, there may be mild swelling for a few days. Choose an injector with extensive training and experience in filler treatments, including the use of hyaluronidase for reversal of filler. Your provider should also have specific experience in training for treatment of the temple region in order to have a safe outcome.